gastroesophageal reflux. What interventions could we use to help with the symptoms of this? So think about it. So you have an infant with gastroesophageal reflux. What interventions could you give a parent to help with these symptoms? Go ahead, just say one. Small frequent meals.
Keep them sitting up after feeding.
Keep them sitting up after feeding.
How?
Well, you can burp them, yes, but.
Oh, is this the rice cereal one?
Yes. Yes, but thicken the formula with rice cereal.
No. That's a correct answer.
Yes. I am mad about this one, because this is, you should, technically shouldn't do this. It's an aspiration hazard. You should use thickets. I talked about it in class. You should use the thickening stuff like we do for adults, for children, not rice cereal, because it plugs the hole in the bottle and then all of a sudden they'll. So, but this is the rice cereal question. Now you'll never forget that question because I hate rice cereal and formula or breast milk. Okay. You have a child diagnosed with anxiety disorder. They have been experiencing like headaches, stomach aches, worrying about everything in school, tests, homework. You're giving education about treatment options for this child. What statement indicates appropriate understanding of the treatment plan? Is it our child will only need to take the SSRIs to control the symptoms? We will help our child make plans to vary their activities to help with coping. We will encourage our child to attend cognitive behavioral therapy sessions, or we will ensure the school is aware of our child should not participate in physical exercise. We will encourage our child to attend cognitive behavioral therapy sessions. Yep. Meds alone aren't going to control this. So, and we don't want to vary their daily activities, do we? That makes it worse. And they probably need physical activity to burn off some of that anxiety and that pressure. How do you do a scoliosis check? Have them bend over, right? Run your fingers down the spine, right? Sweet. So if you're cleaning off an eye that has bacterial conjunctivitis, and it's all crusty, you know, have you seen kids that have the crusty eye and that? So, what's important to teach the parents about cleaning the eye off? How would we clean it off? Do we want to keep the eye moist all the time? Do we want to put drops in every hour until discharge is gone? Do we want to clean from the inner to the outer aspect? Yep. Or do not attend school for 3 weeks. Yeah. No, remember when you're cleaning eyes, doing anything with eyes, we go from the inner to the outer, right? We don't want to pull the dirt towards the tear ducts. If you have a teenage male with nausea, vomiting, and severe scrotal pain, what would you expect for a diagnosis? Yes. Yes, I knew you guys would get that one right away. Okay, you have a young person, let's say 18 years old. They come to your healthcare facility and they're concerned about contraction of gonorrhea. In discussing those signs and symptoms of the disease, which of the following points is essential? Is it sudden swelling in the genital area can occur within 1 day? Is it painful ulcers on the perineum occur and the mouth within 1 week of contractility? I'm gonna spit that out. Is it white frothy vaginal discharge is the initial symptom? Or is it there may be no symptoms seen but the disease is still present?
That one.
That's right. Even if they don't have signs and symptoms, they can still have a sexually transmitted infection, right?
Mm-hmm.
Okay. You have a G1 with a history of oval hydramnosis that just delivered her infant. We should monitor what closely for abnormalities on the infant? Is it neurological, cardiovascular, renal, or musculoskeletal? Means renal, right?
Mm-hmm.
Yes, because what do babies do? They suck in amniotic fluid, they pee it out.
Mm-hmm.
If we don't have the amniotic fluid there, they're obviously not peeing it back out, right? If you have a 6-year-old that's prescribed antibiotic tablets, what do you want to know before you give the medication to the child? If they can take pills, if they can swallow it, you guys got it. 6, it could be, they could not, right? There's some adults that can't swallow pills. So, my kids hated oral medications. They learned to swallow tablets really early. We practiced with Tic Tacs. So I'd have them put Tic Tacs in their mouth and practice swallowing. Because they hated orals. I used to have to sit on them if I had to do orals. Literally, they would fight me tooth and nail. Okay. So you have a 5-year-old seen in your mental health clinic for possible hyperactivity. The mother reports he's all boy. He has been active and does not sit still for more than a minute. What data would be most important to assess, to evaluate his behavior? Is it whether he was breastfed or bottle fed? That kills me. Sorry, just makes me smile. Their medical history for circulatory diseases, medication history for communicable diseases, or review the boy's typical day. Yep. There's a lot of mental health questions in this final for some reason. So you have a 11-year-old who is brought into the pediatric clinic due to frequent conflicts at home and school. Argues with adults,